We're going to get started here. Welcome everyone to our session today. You can see here the flyer. You've joined Building Equity into Sweetened Beverage Taxes. I am so delighted to welcome you. This is the second in a series of webinars to really talk about policy solutions to reduce sugar consumption with a focus on community engagement and health equity. My job is to really just give a welcome, a couple opening remarks, and then turn it to our amazing moderator, Christina Roberto, who's going to lead us through the discussion. And as you can see here, we have a wonderful, wonderful lineup of speakers, and I want to just take a moment to thank all of them for joining us today too. My name is Emily Broad-Lieb, and I'm the faculty director of the Harvard Law School Food Law and Policy Clinic, which is an action learning program that serves partner organizations and communities by providing guidance on cutting-edge food system issues while educating and engaging law students in doing this work and in the practice of food law and policy. Specifically, we focus on a range of areas, including increasing access to healthy foods, nurturing sustainable and equitable food production, reducing the waste of healthy, wholesome food, and then supporting community-led food system changes. This webinar is part of a series that is part of a project of ours called the Approaches to Reducing the Consumption of Sugar, or ARCS project, which is supported by Arnold Ventures. And it's allowed us to offer pro bono technical assistance to community organizations, food policy councils, and local and state government entities at 8 different sites across the US who have applied to us for help in implementing innovative sugar reduction policies. And I want to say a big thank you and welcome to our partners from those sites that are here. In addition to providing that direct assistance and support and research to those sites, our work also includes developing a public toolkit, which will be released later this year, and then organizing dialogues on sugar policy issues, such as this webinar. We had been hoping to do something in person last year, but like so many, we have, this has been, the way that we've had to gather during COVID times. Before I turn it to our moderator, I want to do a couple thanks and housekeeping. As far as thank you, thanks again to our moderator and speakers, and to the staff at the Food Law and Policy Clinic that organized this webinar, most notably Joseph Beckman and Melissa Shapiro. I want to thank also the other members of our ARCS project team, Kristen Sukis, Katie Garfield, and Sarah Downer. As to housekeeping, first, this session is being recorded, so we'll be able to share that recording afterwards. The slides and link will be made available on our site, and we'll send them out to those who are registered for today. And one other note is that closed captioning is available should you need it. There should be an option at the bottom of your Zoom screen where you can type in to turn on closed captioning. With that, I'd like to introduce our moderator, Christina Roberto, who's also been consulting with us as part of the ARCS project for the past 2 years. Christina is the Mitchell J. Blutt and Margot Crotty Blutt Presidential Associate Professor of Health Policy at the University of Pennsylvania's Perelman School of Medicine. She has an undergraduate degree in psychology from Princeton University and a joint PhD in clinical psychology and chronic disease epidemiology from Yale University. She directs the Psychology of Eating and Consumer Health, or PEACH Lab, where she researches environmental forces that promote unhealthy eating habits and brings to bear her really multidisciplinary background in education and into this amazing research. She's a wonderful scholar, strategic thinker, and partner over the past few years, and I could not be more delighted to turn it over to her to moderate this discussion.
Thank you so much, Emily. It's really been such a joy working with your group, and you guys are doing such high impact work. So it's really been fabulous, and I'm so delighted to be able to moderate this fantastic panel today. Let me say a word about structure, and then I'll go on to introduce our speakers. So our speakers are going to talk for the first part. Please, throughout, you can use the Q&A feature to send in questions, and I'll keep track of those. And then, but we're going to hold those questions and ask them at the end. There'll be about 20 minutes for audience questions. So you can also pop questions into the Q&A at that time. So we'll have speakers. I'll ask a couple of questions of them, and then we'll turn it over to audience questions. Okay, so let me introduce this really fabulous group. They all have amazing bios, and I can talk forever, so I'm going to keep it really short. Let's start with Sabrina Adler. She'll be presenting first. Sabrina is Vice President of Law at Change Lab Solutions. She works primarily on legal and policy issues related to preemption and good governance, the commercial determinants of health, and healthy children and families. Next, we'll hear from Javier Morales, who is the Executive Director of Praxis Project, a national organization dedicated to supporting communities building power for health. Javier is a longtime advocate for community-driven initiatives to achieve health equity and environmental justice. And then Drs. Chris Mattson and Jim Krieger will be presenting together. Chris is an associate professor at UC Berkeley's School of Public Health and the faculty director for the Berkeley Food Institute. She's a pediatrician and research scientist with expertise in the design and evaluation of interventions related to pediatric obesity, cardiovascular risk, and health disparities. And Jim is the founding executive director of Healthy Food America. He's a clinical professor of medicine and health services at the University of Washington and a nationally recognized expert in the development and evaluation of community-based programs to prevent and control chronic disease. So without further ado, I'm going to turn it over to Sabrina to kick us off.
Thanks, Christina. Let me get my screen shared here. Great. Okay. Thank you. So I'm going to start by talking about an issue that's related to sugary drink taxes and health equity, but which has broader implications. So some of the folks on the webinar may know about preemption. For those who don't, I will start out by defining the concept. Then I'm going to dive into the relationship between preemption and equity and some of the preemption related issues we've seen during the pandemic. And finally, I'm going to hone in on sugary drink taxes and tee up the rest of the conversation today. So first, for those who aren't familiar with us, Change Lab Solutions is a national nonprofit based in Oakland, California. We advance equitable laws and policies to ensure healthy lives for all. So a lot of our work is really practical and hands-on. We create model laws and policies, we provide technical assistance, we conduct trainings and things like that. And many of our resources are available to download free of charge on our website. So if you're not familiar, I'd encourage you to check it out. To begin with, what is preemption? At its core, preemption refers to when the law of a higher level jurisdiction limits or even eliminates the power of a lower level of government to regulate a certain issue. This can be the federal government with respect to state and local, or state government with respect to local, as you can see in the illustration on this slide. And I'm going to talk about some examples in a minute. I want to note that this is a separate but related concept to local authority more broadly. So the amount of autonomy and authority of local governments varies a lot from state to state and is set out by state constitutions. But even in states that generally have a lot of authority over their own affairs under the state constitution, the state legislature can sometimes remove localities' power to act on specific issues or even across a range of issues. And that's what we're referring to when we talk about preemption. That's true even if the state itself does nothing to act on those issues and is creating what we think of as a regulatory vacuum in those areas. So turning to the relationship between preemption and equity, before addressing preemption specifically, just to do some level setting and context, it's probably common knowledge among most of us that are on this webinar that your zip code can often better predict your health than your genetic code. So we know pretty well that where people live has a substantial effect on disparities in health, wealth, life expectancy, and that those differences can exist between neighborhoods that are really close together on the map. But those things didn't happen by accident. There have been decades of federal, state, and local laws that have played a role in establishing and perpetuating discriminatory systems and institutions that influence where investment and opportunity are concentrated and who has access to those things. So the result of that has been significant inequities in the distribution of things like housing, education, environmental quality, financial stability, all the things that we think of as the social determinants of health. And those inequities have had really profound effects on underserved populations, including increased risk of chronic disease, higher infant mortality rates, and lower overall life expectancy. So to tie this back to preemption, what happens is when communities have sought to do something to remedy these inequities, they have found often that due to state preemption, their zip code is also dictating their ability to pursue more equitable laws through local government action. State legislatures around the country are using preemption in increasingly dramatic and brazen ways to remove local authority to regulate, not just in public health, but also in numerous other areas affecting health. And these efforts are often motivated by ideological and practical opposition to specific policies rather than any true need for something like uniform statewide regulation. A lot of them are based on model legislation from a group called the American Legislative Exchange Council. You may have heard the acronym ALEC. That's an organization whose members include corporations and a lot of state lawmakers. So preemption has long been something that we've had to contend with in the field of public health, but this recent wave is really categorically different from what we've seen before. It's more extreme, it's wider spread, it's often punitive in nature, and it's really often undermining the power of communities of color. For example, in 2016, the city of Birmingham, Alabama, where nearly 75% of the population is Black, enacted a minimum wage ordinance intended to address economic inequities. And as is true in many places, in Birmingham, Black low-wage workers earn about 80 cents on the dollar compared to white low-wage workers. Almost immediately, the state legislature in Alabama turned around and prohibited all localities across the state, including Birmingham, from regulating not just wages, but also benefits and work schedules. And they did this without enacting any state level standards in these areas. Not a single Black legislator supported the preemptive law, and many looked at this as another example of lawmakers manipulating the political and legal process to disenfranchise communities of color. There are numerous other examples of this kind of preemption across a lot of different issue areas, including other employment policies like paid sick time, but also things like housing and more core public health areas like tobacco control. And as I'll get to in a minute, what we're here to talk about today, sugary drinks. But despite these recent trends, I do want to point out that preemption is not always inherently good or bad. It's not inherently adversarial to public health, equity, or even good governance. So if you think about the Civil Rights Act of 1964, or the Voting Rights Act of 1965, or the Fair Housing Act, all of these landmark federal laws have been critical for advancing civil rights, and all three do so at least in part by preempting state and local authority. It's important to remember that it was a long history of discriminatory state and local laws that led to the enactment of these preemptive federal civil rights laws. And even today, we know that there are state and local governments around the country that continue to perpetuate and in some cases exacerbate racial inequities and other injustices. So given this context, there are two things that are clear. First, the overwhelming majority of state preemption right now is likely to harm public health and lead to inequitable outcomes. But secondly, we know from history that local control can be problematic, and it's important for states and the federal government to have the ability to preempt local actions that might be harmful. So preemption has also been impacting health equity in the context of the COVID-19 pandemic, and this is playing out in a couple of different ways. First, cities and states that preempted things like local paid sick leave or local municipal broadband were already starting from behind when the pandemic hit, since residents in those places didn't have access to policies that were really critical for ensuring equity in the face of this pandemic. Preemption also stifled the ability of cities to respond quickly by enacting things like emergency paid sick leave or eviction or foreclosure moratoria. And some states have put into place new preemption measures that are related directly to infection control. So preempting local mask mandates or social distancing measures, or even more broadly, as we're seeing, and could be the topic of a whole other webinar, preempting the authority of local public health officials very broadly. In Texas recently, the state threatened to cut the number of doses of vaccine given to Dallas when the city proposed a plan to prioritize distribution in the hardest hit neighborhoods. So particularly egregious example there. And given all this, you can also imagine that preemption is going to play a role in the longer term response and recovery by hampering the policymaking authority of local governments that are struggling already. At the same time, though, targeted state preemption can help protect public health and advance health equity when the local laws or community opposition stand in the way of an effective response. So, for example, by blocking localities that want to block testing centers or quarantine sites or lift stay-at-home orders before state officials determine that it's safe. So you see the same dynamic playing out here, that preemption is primarily problematic, but also sometimes being used for good, which is one of the reasons why my colleagues and I like to think of this lens of an equity first framework for preemption, where you're thinking about the advancement of equity as the goal and then assess preemption depending on its impact on that goal. One place where I'd argue preemption has been across the board problematic is in the context of sugary drink taxes. So bringing us to our topic for today. Right here in California, where I am, which is the state that's passed more local sugary drink taxes than any other, we saw that these taxes were preempted after what the press and many others referred to as blackmail of the state legislature. In 2018, you may have heard the beverage industry, along with other industries here, qualified a measure for the November ballot that would have made it really difficult for local governments to raise revenues. The ballot measure could have had devastating consequences for cities in California. A few days before the deadline to remove measures from the ballot, the beverage industry agreed to take this potentially crippling measure off the ballot in exchange for the legislature enacting a bill that would preempt local sugary drink taxes until 2031. At the same time, there were several cities in California that had been gearing up to enact sugary drink taxes in order to combat the inequitable health outcomes of sugary drink consumption and targeted marketing to low-income communities of color. And many state legislators understood this. They really clearly opposed this power grab on behalf of industry, but they felt their hands were tied. They really thought they had to vote in favor of preemption because of the risk of this other ballot measure. And they angrily, if you watch the videos of the hearings and the votes, voiced their opposition, but ultimately voted in favor of the bill. So this is a pretty egregious example of preemption playing out in a pretty liberal state that's usually progressive and supportive of local government authority. But this type of preemption has been enacted in other states, Arizona, Washington, Michigan, and attempted in others as well. And usually the tactics that the beverage industry is using are meant to confuse. They do things like focus on grocery taxes instead of sugary drink taxes. And they've spent millions and millions of dollars on these preemption efforts. So just like the tobacco industry, which used preemption a lot to counter local tobacco control measures, the beverage industry would much rather focus on 50 state capitals than deal with thousands of local jurisdictions around the country. Just as a side note, keep in mind there are other states where localities might not have the authority to enact a sugary drink tax for other reasons. They might not have local authority to enact taxes more generally. So I want to end on a more positive note. All hope is not lost when it comes to preemption. There are two main means by which we can push back. The first is through the political process, and many preemption bills are pushed through quietly at the last minute, but that's not always the case. It's possible to organize and fight preemption during the legislative process, either by preventing it from being enacted in the first place or by repealing it later. So in California, you may have heard that just a few weeks ago, there was a bill introduced to repeal sugary drink tax preemptions, AB 1163, for those who are interested. And the second way to push back is there are legal arguments that can be used to challenge preemption laws in court even after they're passed. So I've noted that in many states, the powers of local government are protected by the state constitution, and that certain types of preemption or on certain topics might be unconstitutional. And also the last minute backroom way that many preemption bills are passed might violate some procedural requirements that are established by state law. So here in California, we've worked with some colleagues to file a lawsuit challenging the sugary drink tax preemption law, because we think it violates cities' home rule authority as guaranteed by the state constitution. And our hope is that between the lawsuit and the repeal bill, California localities will be able to make their own choices again about whether to enact sugary drink taxes and how to design them equitably. So those of you who are working on local sugary drink taxes in other states should be aware of and on the lookout for preemption and prepared to fight back. Finally, I want to let you know that we have a variety of resources on preemption available on our website, including a fact sheet on preemption generally, a paper that's looking at the relationship between preemption and health equity, and this toolkit on assessing and addressing preemption for local policy campaigns. We also offer TA, so if this is something that you're dealing with, you can feel free to reach out to me. I also want to note there was a recently published paper in the American Journal of Public Health by Crosby and his colleagues looking more closely at state preemption of local sugary drink taxes, specifically in the tactics that the beverage industry uses. So with that, I will leave you just with the thought that while the current preemption landscape is definitely bleak, it does provide a unique opportunity to bring the conversation about equity front and center. And in that way, we can hopefully ensure that zip codes don't ultimately dictate whether an individual, family, or community can achieve good health and prosperity. And so with that, I will hand it back to Christina.
Thank you so much, Sabrina. That was a really, really interesting presentation and really interesting to see preemption issues in other areas outside of food policy as well. Okay, we are going to transition now. I think Jim and Chris are actually going to present next, and they'll be presenting together.
Okay. Well, good morning or afternoon, everybody. And it's great to be here with all of you today. Wonderful presentation by Sabrina. I'm looking forward to Javier is coming up afterwards. Chris and I are going to talk about a specific aspect that really affects the equity of sugary drink taxes, which is how does the money get spent that the taxes raise? Where's the revenue going? Before I jump into that, just a brief mention, Healthy Food America, which I'm executive director, is a nonprofit. We're based in Seattle, but support policymakers and advocates across the country working on sugary drink taxes and other healthy food policies, and have played a role for the last 6 or 7 years in supporting many of the sugary drink taxes that have been adopted, and look forward to helping others continue to do this. Okay, next slide. So the way the talk will proceed is we'll do a brief overview of just the current state of taxes. Chris will dive into more details about the findings of our study, looking at how revenues are being used. And then I'll give a few examples from Seattle and Philadelphia to dive a little bit deeper into seeing how the revenues are being invested. So you probably are familiar with, but there are 7 local jurisdictions and the Navajo Nation that have adopted taxes on sugary drinks. The Navajo Nation tax also includes other junk foods at a lower rate than the other taxes. The taxes range from about 1 cent per ounce to 2 cents per ounce, with later taxes tending to be in the 1.5 to 2 cents per ounce range. And they're raising significant revenues, and many people are now covered by sugary drink taxes. Next slide. And just to review the rationale for doing sugary drink taxes, initially it was conceived of as a public health measure to reduce consumption of an unhealthy product similar to tobacco tax, and to increase the awareness about the adverse health effects by labeling sugary drinks as unhealthy. But more recently, I think there's been a real marked shift, particularly because of equity concerns, about the importance of taxes for raising revenue to support community health and well-being, particularly in marginalized communities. Taxes are also predicted through modeling studies to reduce diseases such as diabetes and heart disease, and reduce healthcare spending. And there's been increased interest in taxes as a potential mechanism to induce product reformulation, meaning encouraging the sales and production of beverages with lower sugar contents. And for example, in the UK, there's a tiered tax where higher sugar products are taxed at a higher rate than lower sugar product tax. And indeed, this has induced reformulation by industry, where the average was 4.4 grams of sugar in beverages prior to the tax being introduced. It's now dropped to 2.9. And you can see in the dark green bands to the bottom, those are the proportion of sales volume in lower sugar products. And so there has indeed been this shift, but the problem is that sweetness has not really changed apparently. And so there's been a substitute. Oh, there we go. Okay, so the issue is that while they've taken the sugar out, they put artificial or non-nutritive sweeteners in, and this could have unintended health consequences because we don't really know the health effects of those products. So something to keep an eye on. Next slide. Taxes have raised, mentioned significant revenues, and Chris is going to go into this in a lot more detail, but you can see they range all the way up to $77 million in Philadelphia, which is the largest jurisdiction with one of the higher tax rates. Next slide. One of the important points about revenues, what happens over time now that we've had these taxes in place. Industry has been arguing that tax revenues decline over time, and that then means that they're an unstable funding source for investments in communities. But this is not the case. Here's the time trend over 4 years, because Berkeley had the first tax, showing revenues are pretty stable. And that's been the case in Philadelphia and Seattle and San Francisco over shorter time, and Boulder over shorter time periods as well. So I think I will now turn it over to Chris, who's going to dive more deeply into the findings of our work on tax revenues.
Thank you, Jim. So we wanted to figure out how cities have been allocating these SSB tax revenues. And to do this, we did reviews of documents. So we reviewed budgets, reports from the tax advisory councils and the city, as well as contracts to any grantees that had received SSB tax revenue funds. When the intent of the allocation wasn't clear, we also followed up with phone calls to city officials in every city to try and really get to how cities were using their SSB tax revenues. We did this for the most recent fiscal year for which data were available, which was usually the 2019-20 fiscal year. And in reviewing all of these documents, we identified 190 separate allocations across all 7 cities from SSB tax revenues that totaled 137 million. So Jim had shown you the revenue. These are the average annual tax revenues by city. And I'm just putting this up because I'm going to overlay how much was spent in the fiscal year we studied. So these are the revenues, and here in the lighter bar are the allocations that were made. So you can see that in general, there was a very close correlation between how much cities were expecting to receive or were receiving on average annually and what they spent in the fiscal year studied. One notable exception is Oakland, where their allocations actually far exceeded their expected annual revenue. And that was because they had been slow to be able to push out their allocations early on. And so in the year we studied, they were making up for lost time. In reviewing all of the allocations, we organized them into 3 major buckets. So the 3 major sort of themes or areas that arose were human and community capital, which was 2/3 of all investments, or $90 million. Health promotion, which was 27% of revenue investments and 37 million, and just 7% went to tax administration and evaluation. As an example of how we coded these allocations, we identified 12 categories of goals after multiple reviews of all of these documents and all of these allocations. So for example, let's say one of the cities allocates 200,000 to an after-school gardening program, and the program had 2 stated goals, one of which was to increase healthy food awareness among youth, and another to hire and train low-income youth to lead educational workshops. So in looking at that first goal of the program, that would have fallen into our category of increasing health and nutrition knowledge. There were many specific goals that fell into this general area. And the hiring and training low-income youth would have fallen into our youth development category. Most of the allocations only had one stated goal. When there was more than one goal, we would split the allocation evenly. So in this case, we would have attributed 100,000 to increasing health and nutrition knowledge, which was in the health promotion bucket, and then 100,000 to youth development, which was in the human and community capital bucket. That's a limitation to the study because we don't know actually how various organizations allocated their funds, but Javier is going to talk about, he'll give us a deeper dive, details on how community organizations actually spent their funds. So let's look at the 90 million that was invested in human and community capital. And there were 4 different goal categories that fell within this bucket. The largest investment, 58 million, went to early childhood support. And all of this actually came from Philadelphia and Seattle. But this was ensuring that every child would have access to quality early childhood education and quality child care. And we know that this is critical from an equity perspective because kids who've had high quality preschool are more likely to complete high school, to go on to a 4-year college, and to have gainful employment as adults. In terms of the second investment in improving infrastructure, which received 21 million, almost all of this went to parks and rec facilities, as well as some to public libraries. And most of these investments were seen in Philadelphia again and in Oakland. And this was particularly critical in Oakland because a lot of their swimming pools, their public pools, had been closed because they couldn't afford the upkeep for the repairs. And we know that African-American youth are 6 to 10 times more likely to drown. As a pediatrician, this is one of the things that we see very early on and is really concerning. And the public pools that are available in Oakland are one of the places that a lot of youth of color learn to swim. Economic and human development received $7 million. So this is both basically job training and professional development, also critical for equity. Large reviews of job training programs have found that job training provides workers substantial financial gains, but is highly inequitable. Lower income and unskilled workers are less likely to get job training and professional development. And lastly, $4 million was invested in youth development. So this is things like tutoring and college or career preparation, as well as internships for youth. So the $37 million that was invested in health promotion was split across 6 different goals. And increasing access to healthy foods and beverages was the largest investment. That was $17 million. And this went to things like vouchers or subsidies to make fresh fruits and vegetables more affordable for families. Most cities invested in the school nutrition services in their public district. And meal delivery services as well, like Meals on Wheels. $6 million was invested in physical activity, largely again through subsidizing activities that cost money so that all kids and families can join these activities, and also providing free exercises. This is actually a Zumba class in one of San Francisco's parks. General health and well-being received $6 million, and about half of this went to school wellness centers in middle and in middle schools and high schools across cities. This is also critical because we know that wellness centers improve mental health with reduced rates of depression and actually improved educational outcomes for youth as well. Health and nutrition knowledge received $3 million. These are things like nutrition education in the schools, gardens in school gardens, gardening classes in and outside of schools, and community classes too, like Cooking Matters or other cooking classes. $3 million was invested in preventing chronic disease, and most of this went towards screenings, health screenings, both oral screenings and cardiovascular risk screenings like blood pressure screenings too. And lastly, $2 million was invested in reducing SSB consumption. A lot of this went to promotional campaigns like Rethink Your Drink and other counter marketing campaigns that really acknowledge the harms of soda and sugar sweetened beverages. And as I had noted, only 7% of all of the funds, so $10 million, went to administering taxes and evaluating the impacts of what they were doing. By city, we can see that each city really had its own priorities and was able to, with discretion, invest in those aspects that were most important to them. So we can see that the health promotion is the largest bucket for many of the cities, most of the cities in the Bay Area, whereas for Philadelphia, it's almost all human and community capital investments, and Seattle was generally split. All cities also invested in equity or in populations that we're most interested in serving. So low-income communities, 78% of funds were directed to low-income communities, 61% were directed to communities of color, and 58% were directed towards youth. And this is critical because we know that youth, of course, are the largest consumers of sugar-sweetened beverages, and we both want to halt that consumption, lower that consumption, and reduce the risk associated. All cities invested in local organizations, either directly through community grants or indirectly by increasing services that they paid organizations to provide for the city. Jim's going to go into detail about both Seattle and Philly's specific allocations, but I just want to highlight one thing in San Francisco did that I think is a real innovation. So in looking across all of these cities, what's important is I think these investments can act both as examples for other cities about what could be done with these kinds of taxes, and when we share them with the public, it creates greater transparency in how taxes are being used. So one of the things that San Francisco did, they actually put together Healthy Communities grants. And these are $500,000 grants that were given out over 3 years. And the only intention was to build organizational capacity of nonprofits that were working in preventing chronic disease in some way, working towards reducing chronic disease. So San Francisco invested in 12 different nonprofits that are doing work, and their specific goal was, in the first year, there's no deliverables. It's just expand your reach. Try and lay the network so you can actually reach more people with the services you currently provide. And what's critical as we think about the COVID pandemic or other emergent solutions is that expanding the capacity of the organizations to reach more people actually increases resilience. And this is one of the things that was seen in the COVID pandemic, because people were on the ground and ready to go. And Jim will talk about that a little bit. So with that, Jim, I'll turn it back to you, and he'll talk about Seattle.
Great. All right. Wow, that was a smooth transition. That worked. So I'll start. Yeah, I'm going to start off with Seattle, then turn to Philadelphia. And next slide. Let's see. Is Seattle allocated about $19.3 million in the most recent year we have full data for in terms of allocations. And as you can see, the largest investments were in food access and health promotion, particularly in healthy food access, which I'll give you some more details. And the second really big category was in supporting young children through early learning and child development programs. Next slide. So the biggest investment in the health promotion, healthy food access was in healthy food subsidies. So giving people vouchers so that they could afford to purchase more fresh fruits or canned fruits or frozen fruits and vegetables. There's a good body of evidence showing that healthy food subsidies will increase the affordability, purchases, and consumptions of these products as a nice counterpoint to the negative health consequences and the decrease in consumption or sales that we're seeing from sugary drink taxes. And also the revenues go back into local food systems to some extent and support local food systems and local businesses. So Seattle invested about nearly $5 million in these in 2019. And in addition, and as a response to the COVID situation, to help struggling families, invested an additional $5 million in 2020 for grocery vouchers, which could be used across a wide range of grocery products, whatever families felt they needed most, and supported over 6,000 families in helping cope with the economic consequences of COVID. In addition to the food vouchers, there are other investments in healthy food access in terms of delivering bags of fresh fruits and vegetables to preschools, farm to table programs, providing fresh fruits and vegetable snacks in schools with large enrollments of low-income students, in food banks, which also increased during the COVID era, and in meals programs primarily to seniors, whether it's on congregate meals or delivered meals. Next slide. An unique and innovative approach to doing this food work, and somewhat similar to what Chris just described for San Francisco, is the creation of a Food Access Opportunity Fund, which was one proposed by the Community Advisory Board to get more funds directly to community-based organizations led by people of color from communities most affected by food justice issues. So these grants were up to $50,000 for 18 months. And they particularly targeted smaller organizations that were less likely to have received city funds in the past. In addition to this amount of funds, there were additional funds allocated for technical assistance and evaluation support. And you can see that these funds, we'll go back for a sec, Chris, these funds supported a range of activities from food justice education to food-based programs, accessing programs, urban farming, and so on. Okay. The second big area of investment for Seattle was early learning and child development. A large chunk went to actual subsidies to help families be able to afford childcare, but also to building systems of support for children, for developmental support services, for technical assistance to childcare and early learning providers as an investment in the future of health of Seattle. As Chris mentioned, investments in early childhood are important for improving equity in the long term. Now I'll turn to Philadelphia, and Philadelphia took a somewhat different approach to developing its portfolio. Philadelphia primarily invested in pre-K specifically, and I'll give some details of each of these later, and also in building community infrastructure for parks and libraries and recreation centers and playgrounds, and then in their community school system. And what's interesting is, probably many of you heard, Philadelphia really framed their tax primarily as a way to generate revenues for these important community benefits, rather than as a public health measure directed to reducing sales and consumption of sugary drinks. Next slide. So for pre-K, the city was able to add more than 1,000 pre-K slots, bringing up the number to 3,300 kids who are getting subsidies now. And there's a lot of detail in here, but I'd just like to highlight a few of the key points, which is that 88% of the children who are benefiting from the subsidies are children of color, and 75% live in households that have less than 200% of federal poverty income level. So it's really targeting directly on the people who need this most, and which is important from an equity consideration. In addition, it's supporting women-owned and people of color-led businesses. More than half of these childcare that places that are receiving the subsidies are led by women or people of color. Community schools are another equity-centered investment in Philadelphia, and some of the schools that are in the poorest and most marginalized communities. And these community schools become a hub for providing social services, health services, job placement services, enhanced learning opportunities for students and their families. And so the number of community schools was increased from 12 to 17. There are additional students benefiting and more funds available for these kind of activities. Next slide. And finally, Philadelphia has been investing in something called the Rebuild program. And Rebuild is long overdue repairs and upgrades to key facility infrastructure that serves communities, such as parks and libraries and playgrounds and recreation centers. Again, these have been targeting to low-income communities and communities of color, and a significant effort is underway right now. What's notable from an equity perspective is that a large portion of the contract dollars are being awarded preferentially, to the extent possible, to minority-owned businesses and to women-owned businesses. And the hours worked on these projects are, again, trying to emphasize employment of women and people of color. Rebuild is nice because it takes the tax revenues and uses those to leverage much larger bonding projects, so that a small amount of money from tax revenue can leverage hundreds of millions of dollars of bonds to finance these kind of programs. So how do you make sure that revenues go to where they belong? There are a couple of ways to do that, because if you really want to honor the equity-centered intentions of taxes to invest in these kind of communities and investments, you can do this through legislative language, actually specifying by law that the revenues must be invested in these type of activities, or at least you can signal legislative intent by the intent statements and findings at the beginning of a legislative bill, or you can make policy statements as the policy adoption moves forward, where elected officials or legislators make commitments publicly to how the revenues will be used. So there's an example here in the top from Boulder of an actual revenue dedication, where it says that the taxes must be used for health promotion and general wellness, and it must particularly benefit residents with low income and those affected by the chronic diseases linked to sugary drink consumption. Whereas Berkeley, because dedication is more difficult because of California tax law, the findings made it clear what the tax revenue should be used for in terms of reducing the burdens of these diseases caused by sugary drinks. In Philadelphia, the mayor made it very clear when he introduced the tax bill that it was going to be used for those three functions of pre-K and community schools and rebuild. Next slide. But there's a problem sometimes, despite the statements and despite the legislative intentions and even dedication. In Seattle and in Oakland, mayors and legislators have tried to divert funds to other purposes. And this led the Seattle Council to pass supplementary ordinance to make it very clear that how the tax revenue should be used in accord with original legislative intent, and to honor promises made to communities about how the money will be used. So they set up a special revenue fund that the tax revenues must be deposited in, and which has specific guidelines and restrictions on how those funds can be used, as shown on the next slide, which is the text of this ordinance. I guess I didn't share that slide, but I can share that with you if you want. Another key mechanism that communities have used to make sure that the interests and priorities and values of communities are recognized in revenue allocation is community advisory boards. And 5 of the 7 taxes in the US localities do have these community advisory boards. Next slide. So for example, in Seattle, I was chair of the community advisory board for our first 2 years, helping launch it. And our board made recommendations to the city council, which the city council honored, about how to allocate revenues with particular focus on addressing health inequities and education inequities, and making sure that the revenues were invested to honor community values. There are defined members as listed here, represent different sectors and interests, and 2/3 of the current members are people of color. Got the timing, Christina. There is, the board also tries to reach out beyond the board members to do a number of community engagement activities to hear more voices from the community. So doing surveys of community members, hosting community forums, doing workshops for stakeholders and nonprofits and NGOs who work in those communities, and actually hiring community members to go door to door and use their social networks to do surveys and conduct focus groups to find out what people think the revenue should be used for. Next slide. So for example, community forums that we hosted identified healthy food vouchers as the most important priority that people brought forward. And so that helped really drive that degree of investment in those programs. Next slide. So I'm just going to end by posing a question, which maybe we can address more in the Q&A session, which has to do with revenue allocation and affects some important considerations about ramping up and moving from the local platform and jurisdiction, which is where all taxes have been so far adopted, to considering state and federal taxes. And this raises real issues about how to allocate revenues in a way that's centered on community, centered in equity, and where community voices are playing a role in determining revenue allocation. So I'm just going to pose this as a question for all of us to think about, is that as we think about state and federal taxes, how do we center those on equity, particularly from a revenue allocation perspective? And if there's time, we can talk about that in the Q&A session. So I'm going to end there and thank you for your attention and turn it back to Christina.
Terrific. Thank you so much, Jim and Chris. That was really fantastic and really interesting to see how the revenue is being spent in all the different cities. So I'm sure there'll be lots of questions and we'll come back to those at the end. But for now, we are going to turn it over to Javier.
Can you guys see my my screen?
Yes, looks good.
Yeah, okay. So I want to thank the organizers of the webinar and also my co-panelists. I've presented with all of them. I've worked with all of them. This is a great panel to be on. Praxis has been working quite a bit in the sugary drink space over the last few years, and true to our name, we have some reflections that I want to share with you today, and about centering community and equity in taxes. And one of the things that we're learning, and I'm learning especially, is that as we try to initiate more local and statewide tax initiatives, we really have to make sure that we're centering community and community need. Otherwise, it's hard to pass these taxes. And I love all this research that's coming out about how these funds are being used, because we're able to now show how these revenues are going back into community. And this is very important.
Javier, just so you know, you're actually sharing in presenter view right now.
How do I change that? Does anybody know how to change that?
If you just exit the show and go back and click the lower right, just the little screen, it won't do presenter. It shouldn't do presenter view.
So I do that, and then I
lower right and just click the
that, and then that. What do you see now?
Yeah, we still see presenter view.
Anyone else have an idea?
If you go to,
you could also try clicking the little thing at the bottom that looks like a book.
Right there?
Yeah.
There you go.
So
it's not in presenter view, but we can't see your notes anymore. So that should do the trick.
It's okay. I didn't have notes in there anyway. My notes.
Oh.
Okay, just how do I advance this now? Sorry that I'm.
It's
Oh, I
fine.
just
You know
click
what?
on it.
I've been in the same
right.
place. I think if you just either click a right arrow or click
Yeah, I
on
just
it, it
clicked
should
on it.
still advance.
Sorry to the audience. I apologize.
No, thanks for that catch, Chris.
All right. Can you guys see the screen now then?
Yeah. Do you want to try
Okay.
advancing?
I just did.
Uh-oh. Hmm.
Can you try page
Someone
down?
suggests if you scroll down, use like if you press down or scroll instead. It's not advancing for us.
Okay, I'm going to stop sharing and then restart. Okay. Sorry about this.
Don't
I
worry.
got two screens and it just makes everything way more complicated because it just fills everything up. Okay, so
We also, when you try again, Bryn Austin has a helpful suggestion. She says you can try using the mouse finger roll to advance the slides.
okay. All right, I'm going to share screen again. And I had done that, but it wasn't advancing. That was a problem. Okay. What do you guys see?
Yeah, we are still seeing presenter view.
You know what?
Might not be the worst thing if
I think let's just go with it. I apologize to everybody for this, but so let me go back. Praxis, we're a national nonprofit that works in partnership to build healthy communities. You know, we recognize that it's important not only to address the symptoms of inequity, but also to work to transform the systems and structures that have caused and reinforced inequities. And in the sugary drink space, you know, we've filed a lawsuit against the beverage industry and Coca-Cola to get them to stop advertising to children, stop making helpful claims. With partners in California, we continue to try to pass a sugary drink tax. In California, again, we are co-sponsors on the legislation that Sabrina talked about earlier, that repeal preemption in California. And then also through my work in particular, we've collaborated on the design and passage of the first successful municipal soda tax in the United States. And I still continue to serve on the Berkeley Commission that recommends investment for soda tax revenues. And we also continue to support tax efforts across the US by helping to center community and equity. And I say all that because, you know, a lot of this learning is a practical learning, and these are practical experiences that we have. So you guys can all see the next slide, equity. I'm not going to read this, but, you know, again, I just want to emphasize that for us, it's important to not just address the outcomes of equity, but to address the underlying conditions, the systems, and the structures that result in these inequitable outcomes. And for us, we truly believe that communities can be supported to help to engage them in these efforts to change systems. And here's why we do what we do. And Sabrina talked about this earlier, and I think Christine also talked about this. You know, it really does come down to zip codes and, you know, what's available in those zip codes. And, you know, we see the life expectancies that are so different. So on the left right here, we have Stockton, California, and on the right, we have Newport Beach. And you know, what is it that's giving and taking away those days of life? And so, you know, this is the list that Praxis uses of the researched determinants. The dark text are the determinants that we use, and the white text is actually what we feel are the determinants of the determinants, some of the determinants of the determinants, how robustly present or absent these determinants are really are dependent on historical, structural, systemic bias that often manifests according to these the white texted determinants that we have here. The important thing right here is there's two things. One is to understand that equity is mostly intersectional. And then second, you know, you can actually use this list to find allies. You can use this list to find allies in the work that you're doing. And we're actually going to be hosting a training on this at CSPI's upcoming Sugary Drinks Summit. Which brings us to soda taxes. And, you know, this is kind of the person that everyone relies the economic theory on, you know, Arthur Pigou. And, you know, it's a very technical approach. It's a technical approach because, you know, it believes that taxes can correct for externalities. So basically the use of a tax is to ensure that an item's cost better reflects reality. For example, in the sugary drink space, the beverage industry doesn't pay for the health consequences of consumption. Others pay through it. We pay through it through either public or private health insurance, days off from work, disability, and et cetera. But I'm going to tell you guys a real quick story that kind of showed me right away that this is that the what we're up against is a lot bigger. So this is the gate. The gate is on the Senate side of the California Capitol, and we were actually on this day trying to get some legislation passed that would increase warnings of the dangers of sugary drinks. And so while we were upstairs going from office to office to make sure that we were visiting with each legislator's staff to make sure that they didn't have any last minute questions, I got a frantic call from our lobbyist who said, hey, you need to get down to the gate. And our first question on my mind was, what's the gate? And so he told me I go down. And the thing that was really interesting for me here was that it became very clear to me within the first few seconds that our advocacy and our work is not just against the beverage industry, and it's not just about health. It's against all the industries that touch sugary drinks and benefit from the sale of sugary drinks, and also that touch taxation in general. And the lobbyists that we encountered right here included the regular suspects: the Beverage Association, the Grocers Association, Restaurants Association, the chambers, including the Hispanic Chamber, African American Chamber. The Teamsters were there as well. But the one that really surprised me was that the oil industry was there. The Oil Industry Association was there. And their reason was because, they own all the little shops, all the little markets at the gas stations. And so, seeing them maneuver around and pull people off the floor to get them at the last minute to try to get them to engage or to vote their way was just very illuminating to me. So it told me that, this is actually much bigger, it's about the political and economic elite that we're actually trying to work against. And in order to be able to do that, we need to be able to engage our communities, and our communities will come to the table if, we make sure that what we're trying to advance benefits them. And, this is Pareto's the one that talks a lot about the political and economic elite. Gramsci is the one that talks about organic intellectuals and organic wisdom, the wisdom of lived experience that exists in communities that we can work with community members to bring them to the table to help us design legislation that actually benefits them much better. And then we got Frary on the end there. And, I think a lot of times when we talk about engaging community, we come in with the health argument and say, sugary drinks are bad for you because they have all these bad health effects later on. But really, where we need to start is before and talk about why is it that we have so many sugary drinks in our communities? Why is it that sugary drinks are cheaper than water? Why is it that the beverage industry targets our communities for advertising? We need to start further upstream, and that's the Frarian approach. And when we do that, we get to this. And, I'm a big fan of Dolores Huerta. And in fact, the Dolores Huerta Foundation is one of the biggest supporters of a lot of the work and advocacy that we do in California to improve health conditions, especially when we try to reduce the consumption of sugary drinks. That's kind of like the frame for this. So it's not just a strictly technical thing where we raise the price and, folks that don't have a lot of money will reduce their consumption. But really what we need to do now is to show what's in it for them, what's in it for our communities. And one last thing is, and during the intercession before the pandemic, I actually went and just kind of did a little recon in the California Capitol. I went and met with the leadership staff that was in the building, and all of them said, you need to show how these funds are going to benefit the community. So it's not just about long-term big picture health. It's got to be like, what are the programs that this is going to support? So again, really excited that a lot of this research is being done that is actually showing where the funds are going. We need that. So I got a couple more minutes, I think, right, Christina? Yeah, I got a couple more minutes. So this is kind of the learnings, in our tax design, we really want to make sure that we're investing in areas exhibiting the highest rates of inequity. We want to invest in community-defined priorities. We want to ensure that investments support community-led activities and programming. And we want to invest to build community capacity and infrastructure that can transcend the grant period. So leaving, this is a shortcut for talking about building power in communities, and we can use the revenues from soda taxes to do that with an entrance point of health. The next part is, centering equity. Again, community-led norms change, going out and funding these community-led initiatives to, we call it crear conciencia. That's what we call it in Spanish, to create consciousness. And it's basically what I said earlier about not just starting with sugary drinks are bad, you shouldn't drink them because they lead to diabetes, obesity, heart disease, stroke, but really talk about the whys. Make sure that we're supporting programs and activities that are prioritized by the community, counter the industry's marketing, making healthy options available and accessible. There's nothing worse than coming in and saying, don't drink that, but the healthy choices aren't available. And also we need to really focus in on influencers. And Christine and Jim have talked a lot about other examples from other cities, but these are the types of things that have been supported in Berkeley. This is Healthy Black Families. They're doing great work. I'm not going to go through all the details here. These slides are going to be available. I'd encourage you guys to look at the links that are down below. We actually have videos on these. The Multicultural Institute works with day laborers and the children of day laborers. And again, doing this advocacy on the street and also making referrals to healthcare and oral health. It's an incredible work that they do with the sugar or sweetened beverage funds. YMCA of the East Bay, this is generational change that we're starting to affect. The children, the Head Start age children, and supporting the pantry. And these children are actually holding their families and parents accountable to healthy beverages and eating. The Ecology Center has an incredible peer-to-peer teen program where they're training leadership, youth leaders, to go out and advocate for healthier behaviors, healthier lifestyles. And again, centering equity. The little box on the left, the perfect strategy box, that was what we were working with before 2014. And I remember folks coming up to us and telling us, if you guys don't have 2 cents per ounce, this isn't going to be effective. If you don't dedicate the tax, this isn't going to be effective. If this is not a retail tax that is felt at the register where you can see the price difference, it's not going to be effective. And this approach is really focused on raising prices to curb demand and consumption, and success is defined by consumption decreasing as the prices go up. Whereas when you look at the right side, a little bit more community informed strategy, it's not the perfect, but this is designed to increase capacity in the community and increase power to change unjust systems, structures, and policies. And then there's 2 resources that I'd like to point you guys to. One of them is on the Praxis website. It's Working Principles for Health, Justice, and Racial Equity. So if you do want to go out and engage community, there are ways to approach and make sure that what you're doing actually aligns with the community's priorities and interests. And then the second one, and this one's available on the Healthy Food America and the Praxis website. And this was some research that we did. We convened a focus group of national leaders in this space, and we came up with some sugary drink policy recommendations. And again, this is available on the Praxis website and also on the Healthy Food America website. And this work was supported by Voices for Healthy Kids and the American Heart Association. And so I'll end with, we need allies, because when we go back to that one picture of the gate and we see who we're up against, we really need to engage community and show community why this is important, how these funds will go back in a meaningful way back into community to help improve conditions. And that's how we will get to success. And that's how we get to the consent of those who will be taxed, those who the beverage industry comes in and tries to drive wedges with. So I'll stop there. Thank you. Sorry for the problems up at the beginning.
Thank you, Javier. Thanks for such a thoughtful presentation. And thanks for pointing out that resource at the end too. I think that's really helpful that you all put together. And way to navigate the technology challenge. You did great. Just so everyone's aware, I'm going to throw a few questions out there to our panelists for a few minutes, but then we're going to turn to audience questions. There's been a lot of really great ones coming in. So just to start, I think, Javier, I'll start with you. Can you talk a little bit, we saw this initial momentum around beverage taxes in the US, and then it's kind of stalled out. And so I guess there's a two-part question, why aren't we seeing more beverage taxes across the country? And how, can you say a little bit more about how you do get those community groups who may have, very different interests to come to the table and support these efforts?
I don't mean to punt on the first part, but I think Jim would probably be a better one to answer about why they're not happening more across the country. My take on it is, the initiatives that I've seen that are being passed really don't center equity and community as strongly as they could. And I think that that not bringing folks to the table from the very beginning, is resulting in legislation that the community doesn't see themselves in, and so it's harder to pass these taxes. So I think that's the main reason we're again, of the ones that I've seen, they're not centering it as much as they could. And I don't know, Jim, I'm sorry, Christine, I'm handing it over to Jim because I think he has a better pulse on just what's going on at the national level.
Yeah, I think, Javier, your analysis, I agree with. Thank you for sharing that. I think also, I think there's been a chilling effect, as Sabrina mentioned, of the attempts for preemption, and some of the cities that were most poised to do the next round of taxes were actually where preemption occurred. And so it's been an effective industry strategy. So I think fighting preemption is going to be important. And then I think it's also critical to develop the groundwork and reach out and develop grassroots coalitions and bring folks in from the beginning so they are indeed equity-centered taxes, and that takes time. And I think there's a realization that you need to hit pause a little bit to do that base building and ground building. And my prediction is that we'll see that bear fruit. And I think we'll also see some taxes, more activity at the state level, which is kind of the next frontier. And as soon as one state successfully does that, then I think that will open it up for additional states to follow suit.
Great, thanks for those thoughts, Jim. So let me build on that because I think it brings us to a question about preemption for you, Sabrina, which is, you gave some great examples of it's not always bad, it can advance public health, but in the case of taxes, it seems to be preventing at least these taxes from expanding. And so that can feel a little hopeless. Can you say a bit what's to be done? What can we do about preemption?
Yeah, so I mentioned the two sort of primary ways of pushing back in terms of the legislative process and litigation. But even before that, I think a couple things. For those who are working at the local level, being mindful of what's happening on the state level and paying attention to anything you might hear about potential. I think the expectation, if you're working on a tax at the local level, should be that there will be efforts to preempt at the state level, and forming networks with those who are aware of what's happening at the state level and being able to keep tabs on that. One of the things that we've seen be pretty successful is the formulation of cross-issue coalitions that are working to fight preemption more broadly and really are focused on keeping local communities empowered, not just around sugary drink taxes, but around a lot of the other issues that I mentioned too. So folks that are working on employment issues, on housing issues, on whatever it might be, and having that sort of power in numbers and in issues at the state level, I think can be really effective. There are a number of groups that are working to counter preemption more broadly. So Local Solutions Support Center, Voices for Healthy Kids, and the American Heart Association has a lot of good resources on this. We, like I said, have a specific resource on sort of how to think about, assess, and address preemption on our website that folks can access. But I think it's really about staying engaged and aware of what's happening, and not, the danger is getting behind it. And if preemption sort of gets out in front of you, given the power dynamics, it's going to be really hard to, not impossible. Like I said, there's stuff happening in California pushing back even after it's passed, but I think preventing it in the first place is probably the more effective way to go. And that requires collaboration, paying attention to what's happening, and reaching out for resources which are available.
Sabrina, maybe another point, I'm curious what you think of is, we're at a crisis in protecting our democratic processes and institutions, and preemption is a fundamentally anti-democratic policy, which tries to strip local control. And it's not that dissimilar from some of the redistricting and other anti-democracy and voter suppression work. Are there linkages, and is that also a way to build power behind preemption prevention?
For sure. Yeah, I mean, painting it as part of that broader, like I said, I touched on this, and there's a whole other webinar to be had on this, but there's a move to sort of remove local public health authority more broadly, which is really disturbing, I think, for those of us who work in public health and see how important local public health regulation and how innovations in public health have really started across the country all the time at the local level, and what that might mean if that's not an option anymore. And so I think, yeah, another piece of this, Jim, that I think ties to the question you're asking is there's been a lot of communications research on preemption and sort of how to situate it within these broader anti-democratic movements and how to talk about it across political backgrounds and across constituencies, so people really understand that this isn't just about like a single policy issue. You may not like sugary drink taxes or think they're the appropriate policy, but that's actually not the problem. The problem is the community that wants to enact that or doesn't have the ability to make that decision for itself. That's being made in the state legislature, which is, you know, for most things, I would argue, not the appropriate place for that decision to be made. So there's a lot of there are a lot of resources out there on how to message about that issue as well. And if folks are particularly interested in that, I'd be happy to chat with folks offline, and feel free to get in touch. But Local Solution Support Center and American Heart Association Voices for Healthy Kids are two big groups that are easy to tap into that have some of those resources available on their websites.
Great, thank you. So one question, this has come up a bit from audience members, and I was thinking it as well, and I'll direct it to you, Jim, but I think others will probably have thoughts. We now have a lot of evidence that these taxes seem to work in terms of reducing sugary drink purchases, but for those who want to implement one of these taxes in their community, there's a lot of design decisions to think about. And so can you share your thoughts on, you know, how large the tax should be? Should artificially sweetened drinks be included? What's kind of the best design practices at this point, including how do you build equity into it?
I'm sure you want me to start, and then yeah, but I hope the other panelists will help me out here. So I think, you know, the theme of our talk today is around equity. And so a key consideration for tax design is how do you design equitable, equity-centered taxes? And I think the references that Javier gave us earlier are some helpful resources to start talking about that. But fundamentally, specifying who's going to benefit from the tax revenue in either legislative intent or dedication language, and establishing robust community oversight and participation processes into the tax itself are critical elements of tax design, both for the political reasons that Javier mentioned. They won't pass without them at this point if there's not, and they won't get the support from impacted communities, and also just to make the taxes act as a tool to promote equity. In terms of some of the other more technical sort of tax policy design questions, I think current evidence supports a tax rate of, if you're doing a volume-based tax, of 1.5 to 2 cents per ounce as the amount that's will reduce sales to a significant extent and raise substantial revenues, so that there's more to be invested in these kind of equity-centered investments. I think in terms of beverages, to include only one of these taxes that are currently in place includes diet beverages, which is Philadelphia. And that's still an issue that comes up every time a jurisdiction considers a tax. The pros of including a diet beverage that are listed include it broadens the tax base so it can raise more revenue. And secondly, people in some cases raise equity issues because diet beverages are consumed to a higher extent by better educated, more affluent people, and the full sugar ones by less affluent and people with less education. So from an equity perspective, some people say you got to tax what the richer people are drinking as well. And then the third argument, which I think is emerging but is not clear yet, is if indeed these diet beverages which contain non-nutritive sweeteners ultimately are shown to have adverse health effects around obesity, diabetes, and heart disease, where there's some emerging evidence. And there was actually a question in the Q&A of that. It doesn't seem like that's specific to any given specific non-nutritive sweetener, whether it's stevia or aspartame or sucralose. That seems like a class effect. That will help determine that question as well. So I think, but at this point, I think the general practice is to wait and see a bit, and not necessarily include diet at this point until some of these issues are resolved. But each community is going to decide that on their own. I think another, issue that's come up is there are now 3 different basic tax designs. One is the volume one, which we've seen. So you tax a certain amount of cents per ounce. I talked a little about the tiered tax that they have in the UK, which assigns beverages to high, medium, and low sugar content and has a high tax on the highest and a smaller tax on the medium and none on the low. And then you have one based on sugar content. So in South Africa, how many grams of sugar are in the product? And while there are different economic arguments for the different types of taxes, I think one thing that's emerged from my practice is that simple is better in terms of explaining the tax and getting it passed through the legislature. And the simplest tax to explain is either a sugar tax or a volume tax. A good example, I'm working with Rhode Island right now, and in previous years, they tried to pass a tax, which is a tiered tax, and the experience of the legislators who were the sponsor of that say this sunk under its own weight of complexity, and this year they're back with a volume-based tax in Rhode Island. There's been a recent study, a model simulation by the group at Tufts that looked at the different tax models and showed they're all effective in both preventing disease, cardiovascular disease and diabetes and raising revenues, particularly in a nice editorial by Sarah Blake and her colleagues pointing out the benefit from a policy perspective of pursuing volume-based taxes at this point. I can post those references later if someone wants to see those.
Christina, can I jump in? I think that we need to be careful not to get too technical. A technical approach about what's perfect is not always what's good. And a lot of times it's the good that gets passed. And I'll tell you right now that, again, the research says that unless you're doing 2 cents per ounce, 1 cent per ounce isn't going to be effective. But, early on, it's a harder lift. The dedicated tax in California, that was a huge lift, but our research partners that know the research said that it has to be dedicated. If it's not dedicated, it's not going to have an effect. The same thing with, it needs to be a retail tax. If the consumer doesn't feel and see that the price is higher, it's not going to affect consumption. And so there's a lot of optimalities that we can find through the research, but is that the political optimality? And, in Berkeley, I find myself saying that all the time, and I apologize for those who've heard it so many times, but in Berkeley, early on, the initial group that wanted to pass the tax had a vision for it, but it was given advice to them that they should go talk to others who had tried to pass a tax to see what the issue were so that they wouldn't repeat the same mistakes. And they went to talk to Jeff Ritterman in Richmond, and they talked to folks down in El Monte. And what they said was, bring the communities that the beverage industry is going to drive wedges through to the table from the very beginning or as early as possible, and you design the tax with them in mind. And I was with Latinos Unidos at Berkeley, and Vicki Alexander was with Healthy Black Families, and we were brought in. And when we were brought to the table, we fundamentally shifted a lot of what the original vision was. And the reason we did that was because we wanted to be able to come back to our community and say, yes, this is actually going to work for us. Yes, this is not just raising the price so, and making you feel it so that you won't buy it. This is actually looking at this from an asset-based, let's use our expertise, let's use our resources to change our behaviors. So, there's, I always bristle when I hear, what's the optimum? Because I don't think there is any optimum. You got to bring community folk to the table from early on, and whatever they design together, that's the optimum for them at that time.
Thanks, Javier. That's a really nice point. I'm going to go to an audience question, and then I'm going to come back for a question to Chris, but I think anyone can answer this. And it's, I appreciate it's long, so I'm going to try to condense it, and I hope I get the spirit of it. But there's some pushback here and some skepticism around the idea that, public health people have said, oh, we need these taxes. And then we're talking about equity, but it's not necessarily a community-driven approach. And if you're dealing with hunger and poverty, particularly in the midst of this pandemic, this person's wondering, like, it's hard to imagine that folks in those communities are saying, yes, we need sugary drink taxes. I want that. And so there's some skepticism that these taxes in this kind of approach really have equity even built in from the beginning. And so can you all, how would you respond to that concern and that comment? How do we think about that issue?
So, and I think it's a really valid, it's a valid issue. One of the things that I want to emphasize to everyone, most people listening may know this, but not everyone may. These are taxes that are levied on the distributor. People actually don't pay this tax. The tax is paid by the distributor. Their cost of business, their cost of producing the product goes up, and they do pass that cost on to retailers. And so the shelf price goes up. But basically, any low-income family is, anytime they shop for food, they're spending more of their budget on food than a high-income family. So they'll be spending more on sugar-sweetened beverages, but that's only because the cost of the sugar-sweetened beverage has gone up. And when I think about what I want to make sure families have access to, I want to make sure that they have access to healthier products, right, at a low price, not at a high price. But I think Javier really touched on the key way to ensure that it's really equity driven is to bring people in. I think our capitalism in our country is broken. The form of capitalism we practice is broken because corporations have incredible control and they maintain control. And so all of these discriminatory practices that have worked well for them, including in labor, like the laws that the preemption laws in Birmingham, Alabama, or Alabama enacted, all of those things actually perpetuate a system that is broken. And we need, from public health, to be pressing on corporate problems, like these industry problems that actually continue to perpetuate these inequities. And one of the ways to do that is to chip away and say, listen, this product you're making, this is a crap product. It's actually killing people. It's killing more people of color. You should have to bear some of the burden of those costs. And I will say I've had an evolution in thought, in part through talking to people like Javier. I don't care about the reduction in consumption. I mean, I do. I think that that's important. I care much more about holding industry accountable for the harms that its products make.
Great. Thanks, Chris. Other thoughts on this? Jim?
I mean, I can share a story from Seattle where I think which illustrates the importance that these taxes will be equitable if and only if there's real community engagement and leadership in tax adoption and implementation. So when the tax in Seattle was first proposed, it was proposed by public health advocates, and it was championed by a member of the city council whose main policy concern was finding funding for early education and childcare. And but as a coalition was built and voices from the community became more engaged, the focus of the tax shifted markedly, so the top priority became food security, and particularly what was called the food security gap by a local organization that's an effective people of color-led organization called Got Green, who said we need to make sure that these fruit and vegetable subsidies and other ways to address food security are reaching the working poor as well as those who are eligible for SNAP. And that shifted the whole purpose and focus of the tax. And that's why that's the largest single investment now in Seattle for investments of revenues. And it's also what led to a strong community advisory board, and one that the council faithfully adopts the recommendations from that community advisory board. So it's, I think, as we've learned, Javier and others often say this, equity is a process as well as an outcome. And if you design the process of tax adoption and implementation equitably, it needs to reflect the interests and values and priorities of the community.
Can I also say that if the community is not bought in, then the beverage industry can come in and they can organize with them. And we've got examples of that in places where they've been repealed. So, either community is with us, or the beverage industry will come in and bring them with them. And so, this is another reason why it's so important to make sure that the community understands, we have their consent and we have their buy-in and we have their cooperation, because without it, I don't think we're going to be as successful as we could be with them.
Great. So we're talking about equity, really focusing on that today. And one dimension that hasn't been touched on that an audience member is wondering about is these taxes in rural settings. And so there are all these urban examples, and the question is really, how might they look different in rural areas? Are there different kinds of considerations? Does anyone have any thoughts on that?
there is one rural tax, which is the denudation tax, which is not a straight up SSB tax. And the tax is different. I don't think because it's rural. I mean, it includes junk foods and it's a 2% tax. It's a relatively smaller tax, but that was from other design considerations. I think what strikes me about the way the denudation implemented their tax is they have local tribal councils at each of the smaller Navajo pueblos, and each of those is given a certain amount of allocation, and they then in turn autonomously decide how they want to use those funds. So it's a more decentralized approach, and given the dispersion of rural communities, potentially that's an interesting model to think about for other areas. But I think the concept and some of the benefits around equity and addressing corporate influence, and I still believe reducing sales is important, would be realized from rural communities as well.
Great, thanks, Jen. Sabrina, a question for you, and a few different people have posed different variants on this question, which is, it looks like about California tax law, but there's some questions around the laws in California and the ability to allocate revenue to certain populations, whether that's based on race or other things. Maybe there's even something to say about other states, but people are wondering if you could talk a little bit about that and if there are barriers to doing that.
Yeah, let me say a couple of things without backing myself into a corner, because I'd have to do a little bit of legal research to answer any aspect of that question definitively. But so number one, the way that revenues can be allocated and how you need to enact laws in order to allocate those revenues in specific ways differs in every state. So state law is going to determine whether you can dedicate revenues by law to specific uses, and it's also going to determine, like, if you do dedicate them, whether there's a different voting threshold that needs to be met, etc. So that's one piece. The second piece is, in terms of how and to what you can dedicate revenues, there's like a layer of constitutional law in terms of whether you can use race as a designation, et cetera. But then there's also, there are also going to be state law issues involved. So and there are other ways that you can draft laws that use proxies that, even if you are not, permitted to specifically use race as a category, because I see that as a specific question, that there are other there are other ways to think about allocating revenues to communities in an equitable way, even that don't designate race as a specific category. So yeah, I think I can dig into any of those more, but let me leave it at that for now, and then say that all of these design issues potentially raise legal issues, and that's why we try to sit at the table and do specific legal research on the specific state and even the specific locality when these taxes are being enacted, to come up with the menu of different options in a particular place, so that the community can grapple with what they want to do given that legal context.
I think it's important to make sure that our revenues are going into the areas that are most impacted, that we have to have that written in. And I don't think you necessarily need to lead with race when you do that. So I know that in some of the past legislation that we worked on in California for a statewide tax, that we were trying to identify an index that kind of showed the preventable chronic diseases that exist, that are concentrated, and that we wanted to focus the revenue allocation to those areas. I mean, the last thing we want to do is, and the community has been used many times in the past, where they're made promises if they help get something passed, and then it gets passed, and then the next thing you know, the money's being diverted. So community's smart now. They're not coming to the table just because there's promises made. They want to see it in writing. And so we've been very careful to do that. And also there's a lot of work that goes into this. And I think it's more important, if we want to move the needle on healthy behaviors, healthy health education, if we do that in that one zip code in Stockton, if we're working with groups in that zip code in Stockton that I showed, where the life expectancy was 72, as opposed to Newport Beach where it's 88. So I think that I don't think we need to use race. All that to say, I don't think we need to use race. We can use these other proxies.
Great, thank you. Well, I think we're going to end on that note because we're at time. So let me just thank the audience for all the great questions and engagement. And of course, thank our absolutely terrific group of speakers. Really give us a lot to think about. We're really grateful for your time and your ideas. Hope everyone enjoys the rest of the day.